Hi everyone, I'm Samantha Guzman, Assistant News Manager at Austin PBS. Working from home, happy hours over Zoom, dance parties on Instagram. Our social lives look a little different these days. So how are all of these changes affecting our mental health? That's what researchers at the University of Texas at Austin are trying to figure out with the Pandemic Project. Ashwini Ashokkumar is a researcher on that project. Ashwini, thanks for joining me.
Thank you for having me.
So the Pandemic Project is trying to see what are the social and psychological effects that the pandemic is having on our everyday lives. How are you conducting this research?
So we're doing this in two ways. The first is that we have a large-scale survey, and we have respondents, about 20,000 respondents from the US and Canada so far, and we've been collecting data since mid-March. We're also collecting data from outside the US and Canada. That's with the help of international collaborators. And I would say we have about 10,000 respondents from outside the US. And other than that, the second thing we're doing is that we are analyzing people's social media conversations. And by analyzing their language, we can get a sense of what people are thinking, how they're feeling, how they're behaving, and so on. So we've been tracking that. And that's pretty useful because we can go back in time and see how people were talking even before COVID to get a clearer sense of how the course of the pandemic is affecting life.
So what have you guys found out so far? What are some of the common reactions people are having?
I think the most consistent finding, which is really not that surprising, is that anxiety levels are really high, and they shot up even in the beginning of March. So that's even before most cities announced shelter in place or lockdown orders. And they peaked, I think, in about mid March, and that's when most of the shutdown orders began, and that's when most people started working from home. But even though now it's been decreasing since mid March, it's still way higher than what it was before the whole crisis. Another one I can think of that I think is really interesting is that we're seeing that people's sense of community is being disrupted. And what I mean by this is when we ask them how connected they feel with their friends or neighbors, or their city or even the country, it looks like these levels of connection are way lower than pre-COVID.
How is a pandemic different from another crisis someone may go through? I'm thinking like a natural disaster, like a tornado or a fire. How is this different than that?
Right, that's a great question. I think the one of the biggest differences is that with most other crises, the most well-known cure for anxiety and uncertainty is coming together with other people, coming together to make sense of what's going on, to comfort each other, and so on. And I think a pandemic is very unique in the sense that other people are potentially threats because they could potentially be carrying the virus, which then means we can't really come together, or even if we can, there are rules for how to come together or the means through which we can come together, which might explain the patterns I was talking about that when I was saying people are retreating and their sense of community is being disrupted. So this could be related to that. So I think that's one of the biggest differences in that we can't come together to cope with the virus in the way we usually would, because if you think about a hurricane or 9/11, typically any kind of mass shooting attack, typically people report feeling way more connected than before. People feel a sense of solidarity with everyone else, which we're not really seeing in this crisis. And another difference might be that with most other crises, they tend to play out in just a couple of days or maybe a week, but they don't last this long. And they also don't affect the whole country or the whole world at the same time. It's usually localized, which then means that other people in other places could offer support, or it's not that the whole world is under the threat, is under threat at the same time, or that the level of threat or the course of threat is indefinite, which in a pandemic I think it is.
I have to ask, over the weekend, over this past week, a lot of unrest sort of just erupted all over the country. And I wonder what the combination of not only the pandemic, but now all of these protests and social unrest about what's happening in our society, it feels like one thing after another. How could that be affecting how people feel right now?
My most honest answer is that we don't have the data yet. That's something we're definitely actually going to look for. It's a great question, but I don't know. But my guess is that there's already a lot of fear. There's been a lot of loss because of COVID, and people's morale is really low. And at this time, with all the chaos and the videos of violence from the side of the police, and I think all of that could affect the morale of society even more.
Are you guys looking at all on the mental health breakdown as according to race?
We've looked a little bit. I think anxiety among the Hispanic community looks pretty high. I would say higher than other communities. And there is also, um, there's also a lot of anxiety about people's financial situations, losing jobs, and so on, which disproportionately fall on African Americans and the Hispanic community. And they are much less likely to be remote working, much more likely to be involved in uh, in the service sector, essential work, and so they report higher anxiety relating to getting infected, but also relating to losing a job, all the financial aspects of COVID.
What can someone do right now to try to cope with the mixed emotions that they might be feeling?
I think that the best cure for anxiety and uncertainty is people's relationships. So I would say that the most effective way might be in whatever way possible to connect with family and friends, even if it is online and even if it doesn't feel as good as in person interactions. And I think in general, there's a lot of research showing that having a routine or habits gives people a structure in their everyday life, which has a positive impact on mental health. And of course, COVID, the whole outbreak has affected people's routine, like their daily routines a lot. So, but from our data, it looks like people are adapting to this new normal because it's been over 2 months and we're all at home. A lot of people have new routines now, even if it's not their ideal. And habits and routines are so helpful just because there is a structure, which then means we don't have to think about every little thing, and it kind of saves some brain power.
So, what are the next steps for the research project?
Well, so far, what we've been doing is kind of watching what's happening in the world and going with it, changing the survey. We change the survey a lot based on how the world is changing because we have no sense of what's going to happen. So just keep track of what's happening. For example, now with all the protests that are happening, we're going to ask some questions about that. So our plan is to just kind of watch what is happening, what people are talking about online, change our methodology accordingly to understand broadly as much as possible what is happening. And we're going to continue this through the course of the crisis to track long term what the temporal patterns are.
Well, that's great, insightful work, Ashwini. Thank you so much.
Thank you so much. Thanks for having me.